one of the biggest challenges of treating patients with moderate to severe atopic dermatitis is just the options that we have for treatment that are out there. So it's kind of a blessing and a curse, right? You want treatment options for your patient because you know one treatment that works for one patient may not work for the other patient. But then it's up to the provider to really look at these treatments, sift through the data, understand the efficacy, the safety, the patient tolerability, and then translate that over to the patient and try to find the one that's going to work best for that patient. Another challenge that I see for atopic dermatitis patients too is really just for those patients understanding when do we go to systemic therapy. I think that's also on the provider's side and trying to gauge that element of control for a patient, and then also that patient readiness. That's probably the third challenge, where we have some patients that have had atopic dermatitis for years and they don't even know that they could have clear skin or improvement in itch and have a different life. When I'm talking about systemic therapy with my atopic dermatitis patients, I do like to look at that element of control. I really present to them the two big groups of treatment options we have, biologics and JAK inhibitors. And I do like to give them a little spiel of both and sort of how they present a little differently, both with administration, safety, and efficacy. We also talk with patients about that mode of delivery, and especially if patients might have needle phobia. They might be afraid of doing something in the biologic class, and they might preference a pill simply because of the ease of administration. When you're measuring disease activity for patients, everyone sort of has their way of gauging that. For me, I look at a couple different things. So one, when I'm deciding to start systemic therapy, I'm looking at, yes, skin involvement. Not only how much skin is involved, but actually, is it involved in high impact areas? Next, I also talk about itch or pruritus. That's another aspect. Like, can they sleep? Can they go to work? Can they go out in public? Are they afraid somebody's going to see them scratching? So they have fear, shame, embarrassment. So I take that into account. And we're really asking about that quality of life. Are they able to just function in the real world? And finally, something I think a lot of people forget is frequency of topical use. How often are they using their topicals? Because if they're using them and can barely get a break for a day or two and they immediately flare, that systemic conversation needs to be held. And once they're on systemic therapy, I use those same parameters to gauge whether or not that medication's working for them. A predictive tool like a GAP test would really be helpful for my patients with atopic dermatitis because it would further inform the decision of how we're going to go forward with systemic therapy. Nowadays, people are reluctant. They hear risk and they get nervous. And you can see that across the board, no matter what type of treatment we're trying to do for patients with any type of condition. So for atopic dermatitis, when you have two classes, you think of the biologics and JAK inhibitors. And people look at the JAK inhibitors potentially with more reward, but potentially a little bit more risk. Patients are sometimes reluctant to go down that path. But if I had a tool that actually could say, you might respond well to this therapy, I think it might ease some of those fears and concerns and make that conversation easier. The reverse could also be true. If the tool would actually predict that maybe that they are not a good responder to potentially a JAK inhibitor and they're currently on a biologic, it may help motivate them to push through therapy because everyone needs a cheerleader at some point. And as we all know, we would want our skin clear yesterday. So if you're in the middle of therapy and patients are reluctant to continue the course, that test I think would aid in the process of saying, hey, keep with it. You're likely to see potentially some results down the line as well. I think patients could benefit from a GAP test because it really offers them that personalized care. It's individualized to them, and they actually know how they might respond. And that's empowering, right? Because you may not want the same treatment that your neighbor got that worked for their atopic dermatitis. You might be interested, but if you don't know that it works for you, you're not confident that maybe you should go down that route. So I think it really empowers patients with additional knowledge that potentially it could work, or on the reverse, if it didn't work, that again, they could stick with that current therapy that they're actually on.